Minister of Housing, Local Government and Heritage to address the issue of Level 5 restrictions on the construction activity. Senator, you have 4 minutes.
Thank you, Cathaoirleach, and I don't think I'll take the full 4 minutes. I want to raise the issue of the revision of construction activity due to be announced in the coming days. It was welcome that since January essential construction such as social housing has been allowed to continue, but if the indications from the Taoiseach are to be believed, we are looking at another half a year for other non-essential construction activity being restricted. That's fine when it comes to things like people adding on extensions to their houses or something that's considered non-essential, but the effect of non-essential work are affecting some things of critical importance that aren't falling under the definition. I want to in particular raise the issue of Safari Childcare Crash in Clancy Quay, Dublin 8. The renovation works to convert the building to a suitable space had been deemed non-essential. The creche was due to open in early 2021, but the works were delayed due to COVID-19 restrictions. The date of the opening was then postponed to May 2021, and it's now been delayed again, with no certainty or time frame of when we can expect that creche to be open. I've been contacted by an essential worker who is currently on maternity leave and who will have no childcare in order for her to be able to return to work. She has no family in Ireland and can't rely on the extended family to help. Childcare is absolutely essential for women to be able to return to the workplace after maternity leave or be able to continue in their jobs. And we know the majority of care workers, for example, are women. Childcare, especially in this area, which is the largest medical campus in the country in St James's, is even more essential, as many people in the locality are essential medical workers. When it opens, Safari Childcare Quay facility will be also providing free ECI preschool places, but it is essential for many people within the area who live there, who work in hospitals, who work in places like St James's or Rupert Crumlin Children's Hospital to be able to work. I ask that in considering the construction restrictions that the Government expand what their definition of essential projects are, so it covers those that are socially essential. So that's things like schools and that's things like childcare. And I ask that the Minister bring those concerns back to Government so we can ensure that half a year isn't wiped for what are really, really essential, socially essential facilities in order to be completed. Thank you.
Senator, Minister, 4 minutes.
Thank you, Cathaoirleach. On the 6th of January 2020, the Government announced the additional public health restrictions would apply under Level 5 of the Plan for Living with COVID-19. The decisions in relation to the enhanced restrictions followed advice from NPHET that the situation with the virus had deteriorated to the point where there was an absolute need to reduce the level of mobility and congregation in order to reduce all opportunities for transmission. People who have been urged to stay away at home except for absolutely essential reasons. The construction sector has responded effectively to the challenges presented by COVID-19 during 2020. With effective protocols put in place and few outbreaks amongst construction workers. However, the trajectory of the disease was such that the Government took the decision that most construction should cease with effect from 6 p.m. on Friday the 8th of January. The restrictions were addressed in the regulations made under the Health Act 1947 and provided for certain exemptions to allow the continuation of certain essential construction activity. The exemptions were based on decisions taken by the Government and extended beyond the remit of my own department. The exemptions included the construction or development of essential health and related projects, including those relevant to preventing, limiting, minimising or slowing the spread of COVID-19, the construction or development of essential educational facilities at primary and post-primary, including school building projects, certain essential projects relating to the construction and development of Technological University Dublin Campus, Grangegorman, the construction or development of social housing where the local authority where the project is scheduled for completion by the 30th of April, essential works on vacant residential properties necessary to allow the property to be allocated to a household on the social housing waiting list and which are scheduled to be completed by the 28th of February. Construction work relating to housing adaptation grants, subject to the homeowner consenting to the work continuing. Pyrite remediation works scheduled for the completion by the 31st of January, the repair and maintenance of construction of critical transport and utility infrastructure, the supply and delivery of essential emergency, maintenance and repair services to businesses and places of residence on an emergency call-out basis. Housing construction and completion works ongoing on the 8th of January, where such works are scheduled to be completed by the 31st of January. Construction and development projects that relate to the direct supply of medical products for COVID-19. The construction related to maintaining certain supply chains. Work is underway to prepare a revised COVID strategy, taking into account learnings to date, to enable us best navigate the period ahead. This is expected to be considered by Government tomorrow. A return to education for our young people and full-time resumption of non-urgent, non-COVID health and social care are key priorities. In these vital areas, progress will be on a phased basis and at a gradual pace. This is in order to protect and further advance the recent downward trend of the disease trajectory we have seen through the public's collective adherence to public health measures. This will be carefully monitored over the coming weeks, particularly in light of the variant B117, which is now the dominant variant in Ireland. The health and social care system remains under significant pressure during the current wave. While there has been significant reduction in the demand on the system due to the reduction in hospitalisations, the level of hospitalisations at this present time has only just fallen below the previous peak of the first wave. However, the wider construction sector has operated very safely since restrictions were first eased in early summer 2020, and I am confident that it will continue to do so as restrictions are eased in the weeks and months ahead. But just to note with Senator Moynihan, if you want to bring that case to my attention, because you make a very, very valid case, and as a father myself who needs childcare, I can absolutely see how important it is for families to give them that service, and obviously you outlined that case very well, so we'd be delighted to bring it to the attention of the department and see can we get something resolved on it.
Thanks, Minister. Senator, you have 1 minute.
Thank you, Minister. I think that's a very comprehensive reply. I understand the need and the reasons for the restrictions. I do think that expanding the definition to more social projects, for example, schools are able to operate childcare facilities, but I think that's that's a very comprehensive and also open answer from the Minister, and I will forward on those details to him. Thank you.
Thank you. The next commencement matter, Senator Lynn Boylan. Sorry, Minister, let you reply.
Okay, Ciarán. Yeah, thank you, Senator, and I will revert back to you as soon as we can, because you do make a very valid case for an essential service like that, and childcare is one of those services that society needs to be able to work and respond.
Next commencement matter, Senator Lynn Boylan.